Hey there, from the KUOW newsroom, this is Seattle Now. I'm Patricia Murphy with a roundup of today's top stories. It's Thursday, September 11th. Before we get to the news, huge thank you if you've donated to Seattle Now this week. The show is a collaboration with KUOW's local newsroom. You probably recognize the names: Gustavo Sagrero, Casey Martin, Ruby DeLuna, many, many more. Our reporters keep you informed, and we need your support to keep bringing you 2 episodes a day, and even one on the weekend. Now that federal funding for public media is eliminated, we rely almost entirely on you and local businesses. It's our fall membership drive, so join as a member today. The donation link is in the show notes, and thanks for financially supporting Seattle Now. Now on to the news. The company that owns Fred Meyer says it's moving forward with closing 4 Seattle area locations in spite of efforts by elected officials to save the stores. The news comes in a letter from Fred Meyer President Todd Meyer to State Representative Jerry Paulette, according to the Seattle Times. The letter says retail theft and the burden of regulations are still a problem. The company plans to close stores in Seattle's Lake City neighborhood as well as in Redmond, Kent, and Everett. Test scores for Washington students improved slightly this year for both math and English, but they're still well behind pre-pandemic levels. State Superintendent Chris Rakedahl announced the test results this week. It includes grades 3 through 8 and 10th grade. He says math is being taught in isolation.
Especially in our elementary schools, we have to integrate math into more content areas. Our examples can be mathematical. Our opportunities to give kids thought-provoking questions during the day can be more mathematical.
Washington students continue to perform on par with or better than their peers across the nation. There are still big gaps, though, between low-income students and their peers. Rakedahl says the federal government is threatening to rescind funding for historically underserved students. Washington pharmacies are gearing up to administer updated COVID-19 booster shots after state officials authorized them to bypass federal restrictions. Last week, state health officials issued a standing order allowing pharmacists and other healthcare providers to give vaccines to anyone 6 months and older. Ahmed Ali is a pharmacist at Othello Station Pharmacy in South Seattle. He says the state's order has cleared up a lot of confusion for his staff and customers.
Huge relief in the sense that we were keeping all our patients on a standby. We have a list right now of about 20 to 30 patients who called in the last 2 weeks asking if we've received the vaccine.
The state is advising people to bring a copy of the standing order with them to the pharmacy when they get vaccinated. The document is available at doh.wa.gov. A proposed $20 minimum wage must go on the ballot in Tacoma this February, according to a Pierce County judge's order. The ruling comes in a lawsuit filed by supporters of the so-called Workers' Bill of Rights against the city, Pierce County, and the county auditor. Backers collected signatures earlier this year to get the measure before voters, but the city council missed a deadline to put the initiative on the general election ballot in November. The Tacoma News Tribune reports that the judge called the council's action, quote, arbitrary and capricious. Union leaders behind the initiative say the February date will make it harder to get the vote out, but they say the ruling is a victory. A spokesperson for the city says officials are reviewing the opinion. Plans to build a walk-in mental health crisis center on Capitol Hill took a big step forward this week. It was unanimously approved by a King County Council committee. Its location at Broadway and Union in the old Polyclinic building has been contentious. Seattle Times reporter Taylor Blatchford has been reporting on the efforts to build this clinic. She spoke with our very own Paige Browning.
How would this mental health crisis center work? Walk me through how a person in crisis might use it.
So people will be able to walk into this center 24/7 for mental health or substance use care. And the center will accept people regardless of whether they have health insurance or are able to pay for care. They are also going to have partnerships with law enforcement, paramedics, other local first responders where they will be able to drop people off. So those are the 2 main pathways into the center.
Okay.
And then once people are there, there will be 3 different levels of care that they can access. There will be essentially an urgent care where people can have quick appointments with a behavioral health provider. Then there will be a 23-hour unit where people can stay to stabilize, and then a short-term residential area for stays of up to 14 days.
And as I understand, King County actually plans to open 5 of these crisis centers. One's already open in Kirkland. Why is this proposed Capitol Hill location contentious? There's been numerous meetings and a lot of talk opposing or supporting this. Why is it so contentious?
There has been a lot of discussion about this location. I was at the King County Council committee meeting yesterday that you mentioned, and almost 30 people gave public comment on this center. A lot of people spoke on both sides of this issue. A number of people said that they were worried that having this center in Capitol Hill might negatively affect the neighbors' safety. Some people also said that the county hadn't done enough outreach to connect with local residents and businesses. And some folks asked the county to pause for 90 days and take a little more time to engage with people as they make this decision. And then on the other side of things, a lot of people said that there's a lot of need in this neighborhood, which has struggled with street disorder and crime tied to homelessness and drug use. And people are saying this is exactly where we should have this center because this is where people need these services. And some people said that, delaying the decision on where to put the center could cost people's lives.
I spend a lot of time on Capitol Hill and particularly around Cal Anderson Park. And I see, it's very urban. It's going to be the most dense neighborhood on this list of 5 crisis centers for sure, and has a higher concentration of crisis and emergency calls. That neighborhood has a need. So what do opponents say about that? There are people in need right there. They think it's going to be less livable, or what's their argument?
Yeah, people are concerned about just the general neighborhood safety. There's a number of schools near the site, including Seattle University is pretty close, and then some private schools and other local schools. So that's something that folks are concerned about. People have also said that this neighborhood, which has a busy nightlife scene and a lot going on, might not be the most therapeutic for people coming to seek mental health or substance use treatment. But to speak to what you said about it being a very urban area, the county argues that that's exactly where the center should be. One of the requirements that the county put into place as they're figuring out where to locate these centers is that they need to be accessible by public transit and major highways. So this location fits that description and is also close to other medical centers, which could be helpful to partner with or refer people.
Taylor, what are the next steps in moving ahead with the Capitol Hill Center?
The King County Council has until Saturday to pass a motion blocking the county from moving forward in purchasing the center. But it doesn't seem likely that that's going to happen. They would have to do that very soon. So, if that Saturday deadline passes, the county will then have the green light to move forward in purchasing the building. And then the full King County Council is still going to discuss the plans for the center at one of their upcoming meetings. Yesterday, they said that would likely be on October 7th, but that's not set in stone yet.
So there's the question of buying the building and then the question of how it's used.
Exactly. And there will be a lot of things for them to figure out, coordinating with the city of Seattle in terms of safety, how the city will support the center and what the county's role will be. So even if they move forward and purchase the building, there's definitely more things to get ironed out.
Seattle Times reporter Taylor Blatchford speaking with Paige Browning. Next time on Seattle Now, it's Casual Friday. We'll talk about Sound Transit making history with the first ever trip of a light rail train over a floating bridge.
Sound Transit refers to this as their moonshot.
Wow.
So there was a really big question about, will we be able to even do this?
Hear more tomorrow morning. That's all for today. From the KUOW newsroom in Seattle, our producer is Andy Hurst. The interview in today's episode was produced by John O'Brien. I'm Patricia Murphy. Seattle Now and KUOW are members of the NPR network. See ya.